Welcome back to the program. Let's talk some health matters now. With the Nigerian Medical Association, NMA, is drawing attention to the declining coverage of immunization program in the country. The president of the association, Dr. Mark Ogirima, who made this known during the 2017 Physicians Week, explained that more children under the age in Nigeria are not being immunized, which exposes them to risk of death from preventable diseases.
It's 2017 Physicians Week, and the Nigerian Medical Association is focusing on declining immunization coverage in the country. Statistics from the NMA reveal Niger State with the lowest uptake of routine immunization in north-central Nigeria at 20%, Nasarawa State at 34.9%, Kogi State 38.4%, and Plateau State with 45.2%. What this means for Niger State is only 1 amongst 5 children aged between 12 to 24 months is said to have received complete doses of prescribed vaccination.
One of the reasons that we have identified around HOTS here is the fact that during the polio supplementary immunizations, people felt that immunization henceforth is now to be delivered in your doorsteps. But that is not true. There are still a lot of vaccines under our prescribed routine immunization that must be taken at the health facilities.
In Ilori, Kwara State, the national president of the Nigerian Medical Association discloses more disturbing statistics on the immunization coverage in Nigeria.
The 2016-2017 National Immunization Coverage Survey indicates that only 33% of our children between 12 to 23 months of age had 3 doses of pentavalent vaccines against the global target of 90%.
To the south-south, the Bayelsa State chapter of the NMA embarks on a road walk to create awareness on immunization apathy and benefits of immunization at the Swali market.
I want to use this medium to tell Bayelsans that they should come out in numbers, particularly those of them who have children who are in the age of immunization, that they should come out and make sure they benefit from this exercise.
The traders who were hitherto wary of immunization of their children on receiving this information had a rethink.
This one too, the people are clarifying us now. We'll go for the immunization. We will also watch out.
I don't see saying our government send that we go.
Physicians Week is marked annually by the Nigerian Medical Association to assess healthcare services, implement intervention measures, and carry out corporate social responsibility through outreaches and advocacy for implementing health policies by the government.
Now, the sad story concerning the death of the wife of a man known as Ngozi Uchebego, who died due to alleged negligence by doctors at a federal medical center in the Asaba Delta State, is getting more attention as the House of Representatives Committee on Public Petitions has resumed hearing on the matter. But then the absence of the institution's chief medical director stalled proceedings at the court of law.
A few months ago, one Mr. Ngozi Uchebego had accused the management of the Federal Medical Center, Asaba, of complicity in the death of his wife, who allegedly died out of neglect by medical officials at the hospital 24 hours after delivering a set of female twins. The family had petitioned the medical authorities and the House of Representatives, and they had earlier deliberated on the matter. At this present sitting, the case was stalled and adjourned following the absence of the medical director of the Federal Medical Center, Asaba.
I'm mindful of taking the matter to Medical and Dental Council.
Determined to get justice for his late wife, Mr. Uchebego pleads with the committee to fast-track investigation that will reveal the cause of her death.
This is the 8 months, and justice delayed is justice denied. My wife, I'm a human being. My wife is still in the mortuary, and the truth is not yet out. For how many months will it take them? The professors that came used only 5 days or 5 whatever to get a report and indict people. From that period now till now, we've not seen the report. We have reasons to believe that their conspicuous absence in today's sitting is as a result of the fact that there are new documents, new allegations, new facts coming from one of the doctors of the Federal Medical Center relating not just to the death of late Mrs. Rita Uchegwego, but also the death of many other women who died in FMC as a result of the poor negligence and management of pregnant women.
Given reason for being absent at the hearing, the medical director of the Federal Medical Center, Asaba, claims that he had written to the House before now, requesting for the hearing to be moved. In a press release, the medical director of the Federal Medical Center explained that the invitation coincided with the date for the accreditation visit of the West African College of Physicians to the hospital, and as the head of the hospital, he had to be on ground to personally receive them. For now, the matter has been adjourned to November the 8th.
And with that, we come to the end of the program News Across Nigeria. Many thanks for watching. I'm Ayotunde Balogun.